The Faxana might take some time to absorb. There are barriers. When you have intestinal allergy, when you have a lot of other problems, banana has to be swallowed, chewed. Nowadays we are in junk food era. People don't want amma's food. They don't want pizza burger. They want pizza burger. Junk food, fast food era. So that's all the Lakshya said and all. They drink energy drinks. They have the formulated energy drinks, preservatives of course. They are permissible energy drinks can be used with this government, this authorities' permission, because they should not have anabolic steroids and this nandrolone. The steroids will stimulate the brain. They are banned, but permissible energy drinks are like Malvina is there. Malvina is one brand across the sports. They promote it. Malvina is a mango, real mango fruit extract, and that is actually fermented. It has got ashwagandha, it has got potassium rich, calcium and everything on the WHO formula, and they can be substituted. Malvina is advised by doctors. Malvina, ORSL, ORSL rehydrate. There is ORSL rehydrate. What is there? It is not sports person, it is lesser sugar. Eating more sugar causes craves. Earlier we were given glucose powder. When you were a child, you are very lucky. We thought glucose powder lucky. No, it's not lucky. You eat more glucose, you will feel like eating more. Eating sugar gives you craving, not the this one. So you have to give balanced fluid like ORS, L3 hydrate, not only sugar. Earlier they used to give just when we were fallen, they used to give sugar. For 2 minutes you wake up, again fell down after 1 minute. Because the sugar will last the calorie, how much we spend. Next 10 minutes we spend the calorie again. So no sodium, no potassium, muscle cramps. So that is the common sense we should learn from TV. The screen time should give us this kind of education, not the entertainment. Entertainment is okay, it should be side effect. So that's why to treat probable cause of shock, to maintain airway. Maintain airway? If you maintain airway, there is mud, fall in accidents, in building collapses, in burn injuries, fall from tree, in some of the snake bites and all. After snake bite, student has fell down on the ground, mud is covering up the nose, cleaning nose. It's a first aid. Just cleaning nose, clearing airway, cleaning the mouth with the kerchief is a first aid. Like that. Perform CPR. CPR will perform afterwards. Perform CPR when needed. No breathing or pulse. When there is no breathing, we can perform. Yeah, breathing nose will come. So then I want to tell you, very important is don'ts, not the do's. Don'ts. First aider should never prescribe medicine and should never declare death. That's what I want to tell you. This slide I have put. Should never declare death. The student has don't declare death. It so happens after 5 hours after death, livor mortis sets in. Muscle tightening, stiffening of muscles after death is called rigor mortis. Rigor mortis starts after 5 hours of death. Sometimes when you start shifting the body will start, when you shift, some pressure is given, a huge sound, it opens now, and the relatives will think he is alive and you are declared him dead, and they will beat you till you die. The relatives, attenders will beat us till we die. This happened. One last month, one patient came from Piriyapatna, declared death. When they were shifting to ambulance, it's a suicide case. And after 5 hours of galata, husband side and wife side, it's a case of dowry harassment. They have shifted. When the shifting to Mysore, our medical college, I work in casualty and emergency, where I declare 7 to 8 deaths per day. I saw stab injuries, I saw snake bites. My department is only medical legal. Poisons. What are the poisons? Before coming to this department 15 years back, I did not know the brand name. Now I know. Roger, Paraquat, the Roger, famous poison. People in the village. So you cannot use full force. You have to use 2 fingers. Put the chin down with the head slightly head firm. You have to bend slightly. If you push this head also back, you may spine. So there is no need. Just hold it properly. Go for the chin. If possible, with a kerchief, you can use it inside the teeth also. Slowly. teeth is broken, it's okay. Life is important. So, like teeth can be. If he is a lady, lot of girls. When I was married, my wife, after 1 year, she told me this is not a real thing, artificial thing. Girls will have artificial thing. Why? They like chocolates more. I have 46. I'm 46. Not even one tooth is having caries. Not even one filling I have even now. 46. My children are already getting caries. Because girls like chocolates. Right? I think so.
Yes, sir.
I have seen the chocolates are more.
I like.
But not gaining conscious. That means it's genetic. There is some problem, head injury, or poison, or low BP, whatever. There is loss of consciousness is there. So casualty is unconscious without any reaction. Then you have to give CPR. Unconscious, place the casualty in stable side position. That's the left lateral. Airway. If the airway is open, if the nose is open, check. There is no blood clots, no mud, no clothes. Some children will be playing and they put the clothes, they cotton plugs and all. Please check. Their nose is open, airway is open, mouth is open. There is no mud, there is no sand, there is no dirt inside the mud. See, are the potential obstructions is blood clotting, injuries and all, deep injuries, it may bleed. The clots are there in the mouth. If you put them to left lateral position, they will vomit it. Right? If they sleeping like this, if they vomit, they may swallow again and causes aspiration, lungs aspiration, pneumonia. People will not die of accident, people will die of pneumonia, aspiration pneumonia. 90% of the ventilator cases die of aspiration, not because of pneumonia infection. Aspiration is the cause for ventilator in the bedridden patients, multi-organ failure patients. My mother was normal, my grandmother was normal, she was put on ventilator because yesterday she aspirated some food in the hospital. Then she was put on ventilators, like that. So aspiration is, if so, open the airway, clear the airway, clean by kerchief and all. How to open the airway, I showed it. So left lateral position is better. This camera is reversed, they have showed. Tilt the head and back, lift chin up. This we have explained, I think so. Move head, that's what I have told you. Move head as little as possible. Don't move the head like Amitabh Bachchan or Akshay Kumar. Like that. Akshay Kumar does it in films, not regular. 3 pulse you feel, after that there is no pulse. Again after 1 minute you are feeling pulse, means there is some problem, some injury to heart, some injury to somewhere else. Is there a major blood loss? See, if there are fracture cases and all, if there are blood loss in the thigh fractures, blood loss is more. Blood loss, pulse can be feeble. You may not, your 2 liters blood is lost. You not see the blood. Blood is not there. You cannot see. It's not an open fracture. It's a closed fracture. You see the huge swelling. No blood is seen, but pulse is not there. Means there is blood loss here. 2 liters blood is lost, and it's accumulated inside the skin, and he is losing the BP, low BP. So go hospital, shifting hospital. Earliest Kalimunati is the first aid. You don't waste time. Read the pulse, very few pulse, let's shift it, that's all. So that's all. So if major blood loss is no pulse, but then start CPR. CPR will be as a first aider, you have to protect yourself also. So ensure that the area surrounding is safe. Protection of infection. Nowadays mask, everybody will have mask. So you can use it. Gloves if possible. You can use. So wear gloves or wash hands. So first aid kit is one thing which I think every school has. Every school has nurses, I think so. So a small box containing first aid, bandages, plasters. This is just symbolic. These are the items in first aid. Like this is a symbolic diagram. You can take a photo if you want. You can take a photo. But there is we can add now paracetamol tablets. We can add now Vamikind tablets, like on them. Now they are the OTC drugs. OTC means over-the-counter drugs, which are available even without doctor's prescription. that can be life-saving drugs without prescription. When child is vomiting, you can give one chewable tablet on them, Vomikind, easy tablets that can be kept in first aid box. So this can be used. So this is a you want to take photo, madam? Anybody? Okay, can I remove? So the symbolic diagram in the West, it's a diagram from abroad. First aid kit, everybody will have first aid kit. So triangular bandage, sterile pad, cotton, everything I think will be kept. I think every school has nurse.
Yes, sir.
Patients, they are like fractures, ligament tears, sprains and all. So what is dislocation? Dislocation commonly happens in shoulder joint, knee joint, and smaller finger joints. Knee joint, shoulder joint, fingers. So dislocations, when bones are forced out of the normal joint positions, causing injury to your joints. That's called dislocation. Usually shoulders, fingers, and knees. Usually shoulders, fingers, and knees. Usually. So there are waiting, children are waiting for the festival. Morning at sorry, I told them I might come by 1 o'clock. So 1 o'clock sharp, everybody is calling. My second daughter calls now. So I am now black the call. So she is very young. She calls regularly. She is 5 years.
Wow.
So don't move the joint is the first thing. Please don't move the joint. Immobilize. First aid, just take a thread. Just take a thread. Just the shoulder joint, immobilize from here. There are older patients. So there are beautiful. There are children who are experienced more than doctors. Regular shuttler will get regular shoulder joint dislocation. They will fix themselves. People are so strong, so brain is that they will fix. Sir, what, sir? I know better than you, sir. I know better than doctor. But what happens is sometimes there is a nerve called auxiliary nerve here. Auxiliary nerve, when you are fixing, there are sharp edges in the humerus. Humerus has got some sharp edges. That is called greater tuberosity. Spine is there. It's like a sharp thing. It's like a peak in the mountain. If it hits on that axillary nerve, you will get destroyed. For lifelong, you will be like this. Pushpa. Pushpa is like this, this is like this. It will be some pushpa, it is pushpa. like that. So lifelong restaurant is there. So even though you know better, don't take risk. There is a maneuver called TEEM, traction. First you have to pull out. Traction is pulling out the shoulder joint. When the shoulder dislocation, you will see the shoulder dislocation photo I have. Yeah, see that photo. Right shoulder dislocated. See the photo. Right shoulder dislocated. When right shoulder. This shoulder is dislocated. That is normal. What do you think? Which is normal? Yeah, this is normal. That is dislocated. This is dislocated. Right. No, not like that. You can see the prominent the shoulder is. See, your shoulder is not. Your shoulder is changing, so it's now normal. This is come up. Now this bone has come up here. Now this bone has come up here. You can see it. So problem. Light will not come in. Light is there now.
Pointer is there coming in, sir. It's not coming.
This is the pointer here. Press it to go. So that's the shoulder joint dislocation. There is a method called traction. Traction you pull out. External rotation. Then you slowly rotate externally. Rotation. TE. Abduction. First the shoulder is like this. Traction. External rotation. Abduction. Slowly take it out. Then abduction. Medial rotation. Then if you pull out, external rotate, abduct. Then like this, it will be again knee joint. That's called TEEM. That will be done by doctors. 75% of the shoulder joint dislocation can be handled. But there is one checkmate here. Posterior dislocation. There are shoulder joint dislocations anteriorly, comes front, that can be done. If it comes posteriorly, very bad. Posterior dislocation, people will be crying and coming, crying. So, to minimize pain, sleep, better is sleep. Just okay, thread across, sleep. Don't ask them to move. Immobilization is the best first. So then you go to doctor, doctor will take care. Don't become doctors, please. Become actors, don't become doctors. Then fracture. What is fracture? Fracture are the breaks in the bones. Fracture occurs when too much pressure is applied to the bone. And there are many types of fractures, open fracture, closed fracture like that. There is no need to worry about that. This is an open fracture, you can see. The fracture is open. You can see the fracture. So, and this is a closed fracture. He has hit his left hand. Left hand is, you can see there is some rotation. The black boxer, left hand there is some deviation. This is a closed fracture. If you zoom it, you will see. Actually, I cannot zoom it. In my system, I was able to zoom it. Here I couldn't. So then the ligament injuries. What are ligaments? Ligaments connect bone to bone. Tendons connect bone to muscle. Ligaments connect bone to bone. They are elastic. They are slightly elastic. They are double jointed. Actually, refer to ligaments. Tendons connect bone to muscle. They are flexible, but tough. Tendons are flexible but tough. So sprains happen when there are injury to ligament or overstretched. Twisted ligaments like this, twisted, overstretched ligaments. They happen in shuttle badminton, volleyball, runners, and all that. The protection. Stabilize the area. Stabilize. Just give kneecap. Just immobilize. Rest. Ask the child to take rest. Don't run. Don't play again shuttle. Take rest. Rest, what does it does? It slows the blood flow. When you children take rest, blood flow is stopped. So then the swelling is less. Not stopped, blood flow is less. Eyes, give eyes. When you give eyes, it gives vasoconstriction. Blood supply comes down and swelling comes down. When swelling comes down, faster recovery. Swelling is more, recovery is slow. And people will be, oh, huge swelling, madam, gone like that. The student itself pregnant. The swelling is less, recovery faster. So compression, close blood flow, elevation. Foot end has to be elevated. When there is sprains here, foot end has to be elevated. Gravity, because of gravity, when you walk around, ankle joint sprains will get more swelling. You ask him to take rest. When the patient children is sleeping, put a pillow on the foot end elevation can cause decreased swelling. So that slowing the blood flow, reduce swelling. The more swelling, longer time. That's what I told. More the swelling, long time to recovery. Lesser swelling, fast recovery. So that's all. So I want to welcome to CPR.
We are from Kerala, no, sir. So we are going on after 4-5 days. We contact with the second
It's the budget clearly there.
Yeah, that he told. Either he told either we can undergo a small surgery.
What is it?
That's why it is. Also again, whole night he was
Push it like this, like this. Small screw. Can take it. Sometimes it will recover. Easy it will recover.